The Make America Healthy Again movement has a target.
The one place that I would say that we need to really change policies is in the SNAP program and food stamps.
And Health Secretary Robert F. Kennedy is not alone.
SNAP is critical for struggling families, but it's also a huge taxpayer subsidy for things like soda, candy, and dessert.
Arkansas Governor Sarah Huckabee Sanders sending a letter in December to the Departments of Health and Agriculture, asking the agencies for a waiver prohibiting junk food purchases on SNAP.
Certainly no one wants to watch the most vulnerable poison themselves on the taxpayer dime.
A number of other red states also introducing similar legislation in the last year. Conservative think tank, the Foundation for Government Accountability, has supported all of them.
This is a huge issue that people like Governor Sanders are trying to tackle, and they're really responding to American voters on this.
But it can get a little sticky. Take a proposal in Kansas, which defines candy as unrefrigerated and flourless food with natural or artificial sweeteners. Under that definition, Kit Kat and Twix bars, for example, are still SNAP eligible since they contain flour.
There is no universal definition of what is junk food or what is candy. And if us nutrition scientists are still working on this, how would you expect a consumer to know? How would you expect a checkout person to know?
Even the president's favorite, Diet Coke, would get swept up in the Arkansas bill, which defines soft drinks to include artificially sweetened beverages. The American Beverage Association saying such restrictions, quote, won't make anyone healthier, adding they would, quote, turn grocery stores into the government's food police. So far, no major changes from the federal agencies. HHS telling NBC News it gives SNAP participants guidance on making healthy choices by minimizing ultra-processed and high-sugar foods. And the USDA saying it'll, quote, explore ways to support nutritious choices through SNAP. Critics also point to the lack of access to healthier options and question how effective such policies would be.
Evidence would much more strongly suggest something like a soda tax versus restricting SNAP purchases.
If this talk of a soda tax reminds you of something,
obesity is a national epidemic that's getting worse.
It's because former New York City Mayor Michael Bloomberg tried to push it through more than a decade ago. Many experts then and now say a soda or junk food tax would increase revenues and also encourage people, regardless of income, to consider healthier choices, reducing the stigma low-income communities already face. A USDA study showing that sugary drinks are the #1 product purchased using SNAP benefits. But it's more or less in line with what all American households buy.
I'm saying what the critics are going to say. That RFK Jr. is just a new Bloomberg nanny state.
But proponents argue the government already restricts certain food and drink.
If people cannot buy beer or cigarettes, or even rotisserie chicken and prepared foods, removing soda and candy should be a no-brainer.
Setting up a political battle over what ends up in your fridge. Yasmin Vossughian, NBC News.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.